Okay. I'm going to turn off some lights. Maybe you can see them a little bit better. I hope I don't have to write much on the board. Okay. Is there any question for us? Does anybody have any question? You know, the questions that I ask, try to come up well after I'm done talking. Toxoplasmosis is the name of the disease. For example, what is the name of the disease for Plasmodium? Anybody? Malaria. So you cannot say plasmodiasis. Am I making some sense? Most diseases you can put SIS or SIAS at the end, and that's the name of the disease, like trypanosoma. You can call it trypanosomiasis or African sleeping sickness or sleeping sickness. I hope I'm making some sense. Giardia, the name of the disease for Giardia is not diarrhea. The name of the disease for Giardia is giardiasis. I hope I'm making some sense. Giardiasis. But what are the signs and symptoms? It's diarrhea for Giardia. I'm talking about Giardia. Okay? So, the name of the disease for Toxoplasma gondii is toxoplasmosis. Okay, first it was discovered by Mansus and Nicole, two scientists in Africa back in 1908, more than a century ago. These two guys, Nicole, I believe, was from England, and Mansus was from Germany. So they were in there researching Leishmania, and they stumbled on Toxoplasma gondii. Okay. So they found it in Pterodactylus gondii. It's a rodent, it's a lab rabbit, and then typically only cause harm in immunocompromised patients, patients who are immune system is suppressed. This can cause problem. Based on the statistics, half of us in this room, half of the population in the United States have Toxoplasma gondii. So that means half of us, that's the college students, half of us in this room, this is a small sample, you all took statistics, this is a very small sample, half Toxoplasma gondii, we don't even know it. Okay, I hope I'm making some sense. Parasitize nearly all mammals and many birds. It kills marsupials and wallabies. Marsupials and wallabies are not lucky like us that our immune system fights it and get rid of it, not get rid of it. We live with this parasite for the rest of our life. But marsupials and wallabies, they die because, I guess, over the evolution, their immune system have not been adapted. They would not. We talked about this discussion that the parasites become commensalism and so on and so forth. These guys are at early stages of the parasitism, evolution of parasitism, possibly. This is the organism. This is the rodent, Tunisian rodent, lab rats, whatever you want to call them. They are, that's where the Mansus and Nicole found it. That's the organs. This is the life cycle of Toxoplasma gondii. I guess that was one of your guys' questions. So the cat, and only cat, that is something unique, different from the rest of the apicomplexa you studied. Sexual reproduction of this organism occurs only and only in cats. Any kind of cats. Domestic cat, wild cat, all of the feline family, if you know what I'm talking about. Okay, so all of the cats, domestic cat, wild cat, any cat. This sexual reproduction happens in the intestine of cats, and cats only. You remember in Plasmodium, the sexual reproduction happens in the mosquito gut, right? You remember that? We talked about it. This is in cat. Same phylum. You're talking about same species in the same phylum, different species, Toxoplasma. Then the cat releases the oocyst after fertilization of the microgamete and macrogamete. It goes from intestine of the cat, goes into the feces, and in the feces, what happens? Rodents come across it and ingest it accidentally. This can stay in the environment. The oocyst can stay in the environment for a long time, 6 months or so. So this rodent can come in contact with it, eat them, digest them accidentally. And then if another cat, a healthy cat, eat its rodent, then that cat become infected. Because this is now inside of, and I'll show you some pictures, inside of the meat, inside of the organs of the rodent. Toxoplasma gondii is. And then, of course, when the cat eats this, and I'll show you some pictures, then become infected. Also, some insects, like fly, we talked about this in case of Giardia, Cryptosporidium. Some organisms like this, they sit on cat feces and they pick up from the legs pick up the oocyst, and the oocyst can infect, of course, farm animals' food or human food, and we human become infected. That's another route. Another route is we human become infected by eating farm animals' product, like goat's milk or meat, pork. We eat it, we become infected with it. Okay, so those are some of the ways that how this organism gets around. This parasite, that's why half of us are infected. Okay, this is right here. You do have it in your slide collection. You're responsible for it for lab practical exam. This is the oocyst of Toxoplasma gondii. And guess what is the poop of? This is poop of what? Cat. Cat. That's a cat. In this case, it was a domestic cat. They brought it to the lab, and then we looked at it. We found the oocyst in the cat feces, and then we told the owner that your cat has Toxoplasma gondii. And I'll go over that in a minute. Hang on. Okay, these are again the oocyst, unsporulated oocyst and sporulated oocyst. What does that mean? This oocyst must stay in the environment between 1 to 4 days to become sporulated. Okay, and we talked about sporulation a little bit. This one has only 1 nucleus. This one has about 8 nucleus, 8 cells inside of the oocyst. And this one can stay in the environment for about 6 months in case of Toxoplasma gondii. Every species is different. In case of Toxoplasma gondii, it can stay in the environment for 6 months, and then after 6 months we ingest it, we become infected. So it takes about 1 to 4 days to become sporulated. Okay? I hope I'm making some sense. Then, of course, if somebody ingests this or another animal, any animal, I'll list you most mammals and birds, the very first slide I showed you, ingest this accidentally by water or airborne. It can become airborne. Okay, by water or put it on the food, and insects comes and grab this on the leg and put it on somebody's food or farm animal's food. We ingest that, these animals, and then inside of our body they break down, these 8 break down and multiply rapidly. And this is what Mansus and Nicole saw in Africa in 1908 on a microscope. They saw that these are like a toxo. Toxo, it means like a bow and arrow. Plasma, it means body. So they call it Toxoplasma gondii. The gondii was the name of the rodent they found it in. So they call it, they could simply call it Mansus and Nicolier, for example. They didn't. They call it Toxoplasma. Toxo, it means bow and arrow, and plasma gondii. So this stage of this parasite is called tachyzoids. So when the person ingests the oocyst, or an animal ingests the oocyst breaks open, those 8 break open in the intestine, and they start multiplying like a crazy. They call it tachyzoid. Tachy, it means fast, rapid. Somebody have tachycardia, their heart beats very fast. That's a problem, right? So these organisms are multiplying inside of human or animals, cat, even cat. They're multiplying very rapidly. So it's called tachyzoid. It is Toxoplasma gondii, but what stage of Toxoplasma gondii? It is not the oocyst stage. It's not the oocyst stage. It is the tachyzoid stage. Still Toxoplasma gondii, right? Water can be as a vapor, right? It can be a vapor. Water can be frozen. Still water. Am I making some sense? Still H2O? Okay, so this is still Toxoplasma gondii, but they're multiplying. This is a picture of bradyzoids. Brady means slow. So the host's immune system, whatever it is, this is the picture from brain of a mouse, a laboratory mouse. We did take a picture of it, stain it, and take a picture of it. So the immune system of the host is slowing down the tachyzoids from multiplication. They have strong immune system. We have strong immune system, slowing it down. So they form a bradyzoid. Bradyzoid, after a while, breaks and form tachyzoids. And our immune system comes again, slow them down, bradyzoids again. So constantly inside of the patient, the person's body, tachyzoid, bradyzoid, tachyzoid, bradyzoid, tachyzoid, bradyzoid, constant. Okay? Yes, Larry.
Are these tachyzoids, are they reproducing asexually or sexually?
Everything is asexual. Inside of human, pig, any animal, we are all intermediate hosts, except what? Cat. It's just only in the intestine of the cat. Some of these tachyzoids, some of them become microgamete, some of them become macrogamete. And then, of course, they fall in love and do fertilization. Okay? Okay, this is another picture of bradyzoid. It's a cyst. They call it bradyzoid cyst. It's different than the cyst you saw in Giardia because this is inside of the organism like a cancer cyst. It's not a cancer cyst either, but they call it a bradyzoid cyst. It's not a tachyzoid, it's a bradyzoid cyst. Okay, this is the life cycle of Toxoplasma gondii. Let's go over it one more time. Of course, the slide is reversed. They took a picture of it reversed. But anyhow, cat released the oocyst in the feces, right here. In the feces, it has to stay in the environment to become sporulated oocyst. And you saw that before. I showed you the pictures. So the sporulated oocyst can be ingested by farm animals. In farm animals, you have bradyzoid in the meat or organs, different organs of the body. We human eat the meat or organs of farm animals or goat's milk if it is not pasteurized. Pasteurization kills the bradyzoids in the goat's milk. And we eat farm animals and we human become infected. What effect has on human? If a woman becomes infected during pregnancy for the first time. That's the key thing. If a woman becomes infected during pregnancy, then the baby can be aborted, miscarriage, or mentally retarded. You have a baby, but the baby can be mentally retarded. It affects the nervous system of the baby, the fetus, I should say fetus. Okay, how many percent of what are the odds? 50-50. The odds are 50-50. 50% of the time, if a woman eats this Toxoplasma gondii, either by cat, oocyst, she goes gardening, right? And the neighbor's cat came to your yard, you don't have control over your yard unless you have white fences. You don't let anything comes to your yard. Okay, and then you go gardening and the oocysts become airborne, and you don't wear a mask, and you're pregnant also. See, all of those conditions have to be there. And then you're pregnant, and you know you're pregnant or you don't know, then you ingest the oocyst, voila, you have the infection. Yes?
Does the presence of the oocyst indirectly affect the baby's development, or will the baby actually have oocyst in its own body once it's born?
No, remember, the oocyst when we ingest it becomes inside of the mother, becomes tachyzoids, and those tachyzoids cross the placenta, not the oocyst. Tachyzoids cross the placenta and go infect the baby. Okay, so it's not the oocyst. Oocyst is just the beginning of the process. Is that right? No. Okay, so again, life cycle, if you want to know it, cat and only cat, they can eat mice. But in the mice, you have only bradyzoids or maybe tachyzoids, and cat is eating the bradyzoids in the mice. mice do not have oocyst, right? We do not make oocyst. We do not make oocyst. Farm animals do not make oocyst. They make bradyzoid cyst in their meat. And we eat that meat, we don't cook it. That's the problem. We cook it, we got Houston, we are okay. And then of course, the fetus right here affects the brain. And so the transmission, there are 3 routes of transmission of this organism. It is congenital, which is what? You tell me. I forgot. I get a sip of coffee while you're telling me what congenital means. I forgot.
Birth carried from offspring.
From mother to fetus. Yeah, congenital. From mother to fetus. We have many organisms, many sexually transmitted diseases. Bacteria, viruses can cross the placenta and infect the fetus. HIV is one of them. Okay, but anyhow, carnivorism. What is carnivorism? Eating meat, right? We eat meat. We are human. We are omnivores. We eat meat. And then of course, fecal, oral. Not necessarily fecal. I don't mean we go actively eat cat's poop. No, we don't. But remember, those oocysts become airborne. So if you have a cat inside of the house and the cat poop in the litter box, am I making some sense? And then you go, tonight I'm tired, I'm not going to change the litter box. Tomorrow, after 24 hours, remember, after 24 hours, those oocysts in cat feces can become airborne. You ingest it, voila, you have Toxoplasma. I hope I'm making some sense. But within 24 hours, less than 24 hours, you change the litter box, you're home free, no problem. I hope I'm making some sense. You're okay. Okay, here is a hydrocephalic brain of a child with hydrocephalic brain. It means Toxoplasma made the brain full of water. So this baby died shortly after this picture was taken. It was a newborn, and usually that happens. Let's say this is not an accurate number, but let's say 50% of all of us in here have this organism. And there have been so many studies. They've done so many studies, and they found out the same number. Half of the population, they took large samples, half of the population, male and female, have Toxoplasma gondii. So theoretically, I said, you all took statistics. Half of us in this room have Toxoplasma gondii, and we don't even know it. Right? Huh? Okay, let's say 30% of the women who can have children, not after menopause, not before age 11, 12, those women cannot have children, right? Before age 11, 12, after age 45, 50, somewhere in that neighborhood. Let's say 30% of them in the United States have antibodies. It means they have Toxoplasma gondii. Let's say they have Toxoplasma gondii. That was one of your questions. These are the women who have Toxoplasma gondii. They got it when they were, I don't know, 10 years old, 11 years old, 20 years old, right? They didn't get pregnant, and they caught a cold. They thought they have a cold. That's what the signs and symptoms of Toxoplasma gondii is. When you catch it for the first time, when you catch it, you feel like you have a cold. You have a flu, you have a little runny nose, headache, fever. Your cold goes away after how many days? Your flu goes away after how many days? Oh, so in case of Jose, 2 days. Wow, you're a strong man. Usually it takes a week. 5 to 7 days, your cold, your common cold, flu. Jessica, is that right? You can put that aside if you guys want. It goes away. The cold goes away. And after your cold goes away, what happens? Do you go to a doctor to say, hey, check me for Toxoplasma gondii? No. That's why we don't know we have it. Am I making some sense? Because we come down with cold, and the cold goes away, and we never worry about it. How many colds you caught in your life, or flu? Many times. One of them could be, I'm not saying you have it, one of them could be Toxoplasma gondii. But anyhow, so these are the women who have the antibody, they check the blood, and they have the antibody for Toxoplasma gondii. Now, do we have to give them recommendations? Worry about this, worry about that, or no? Let them have children, let them be. We'll let them have children, let them be. Okay. One of the things I would like you to know is the name of this drug. Don't worry about the rest of the slide. That's for immunology classes. But clindamycin is an antibiotic which is given to women who know for sure, they check them, they know for sure during pregnancy they became infected with Toxoplasma gondii. During pregnancy. Am I making some sense? Not years or months before pregnancy. We don't give them clindamycin. Clindamycin has its own problems, side effects, so on and so forth. But women who become infected during the first trimester or second trimester, third trimester, they usually put them on clindamycin. Okay. So from mother to placenta, transplacental transmission about 45%. Out of that 45%, as I said, you know, from mother, if she becomes infected during pregnancy, from mother to fetus, it's 45% of the time. The other 45, the other 50%, half of the time, the baby is going to be normal. I hope I'm making some sense. So the odds, the chances, how is that, Amir? How come it's not 100%? I don't know. Nobody knows. It's just based on the statistics, the studies they've done. 50% of the times, from mother goes to fetus. So out of those 45% that it goes through placenta, 60% are subclinical. The babies have some subclinical signs. 9% will die, just like the picture I showed you. 30% will have hydrocephalus. Again, usually they die. Oh, and they put them in together. Sorry. And mental retardation. So the baby is born mentally retarded. Okay. Yes. What is what? Subclinical, it means they have it, but they do not show great signs. They call it subclinical. They do not have a cephalic brain. They are not mentally retarded. Mentally retarded and hydrocephalic brain is clinical. Subclinical, they have it, but they usually don't show great signs and symptoms. Okay, the babies. Again, we're talking about the fetus. Again, when I was in Tennessee, again, I'm making up some stories sometimes here. The veterinary students used to come. I used to work, the research I've done was in Tennessee. And the vet students used to come, the female vet students used to come to the lab, say, Amir, this is Christmas break or summer break. Don't have to worry about it. Can you give me some live Toxoplasma gondii? I drink it, right? I had access to oocysts, I had access to bradyzoids. But anyhow, can I drink it? Can I have it? I said, no. Why not? I have time off. I can catch a cold for a week and go on for the rest of my life. I vaccinate myself. That's what they were thinking. I vaccinate myself. I'll go on with the rest of my life. Don't worry about, becoming infected during pregnancy. I said, no. One of the reasons is sometimes in South America and Central America, it could be in the United States too, this organism goes to the eye and makes the person blind. Okay, so that's one of the problems. It's called chorioretinitis, inflammation of the eye, and as you can see in this picture. So it is possible. This parasite usually does not go to the eye, but in some cases, in some people, it goes to the eye and makes the person blind. Also, you never know what life is going to bring you. You never know what life is going to bring you. You might get cancer, and they have to put you on immunosuppressant drugs. Some cancers, they put you on drugs to slow down your immune system, right? Then, if you have Toxoplasma gondii, you got it back in Tennessee when you were a student, a vet student. Now you have to deal with Toxoplasma gondii too, right? If you do not have, remember, if you do not have a strong immune system to slow down the tachyzoids to bradyzoids, then what happens? These organisms, in case of HIV patients who have HIV and eventually develop AIDS, which means CD4, CD8 numbers goes down, immune system goes down, not completely destroyed, immune system goes down, immunocompromised, that's what they call those patients, immunocompromised. Then Toxoplasma gondii is a person who was 10, 20 years old, for example, became infected with Toxoplasma gondii. At age 30, he contracted HIV. Then they're coming back and haunting that person. That's why you do not want to have HIV by trying blood. I'm not saying you're not practicing a safe sex or anything. I told the vet students, maybe you need a blood transfusion and they give you that blood that has, not in the United States, other countries, the blood has, you go and you go to a third world country, you get in an accident, they rush you to the hospital, they put you blood transfusion, you need blood, and the blood has HIV. What you gonna do? Am I making some sense? Am I making up enough scenarios for you that not to drink Toxoplasma gondii? Okay, Toxoplasma prevention, no vaccine for this parasite. As I said before, there is no 100%, I'm talking about 100% vaccine for any eukaryotic cell that I know of. I don't think there is none. Okay, so all meat should be cooked at about 70 Celsius. Is not much. You say, Amir, 158 Fahrenheit, that's not much. But is the inside of the slab of the meat very inside of it? The outside becomes 158, that's no problem. But the inside, does it become 158 really? You know, a lot of times you go eat steak and inside of it is juicy or bloody, I don't know what term to choose. I don't think it reaches 158, okay? Goat's milk and only goat's milk should be pasteurized, not cow's milk. I didn't mention cow's milk. I only mentioned goat's milk. Should be pasteurized. Pork, of course, the cow's milk. Cow's milk has other bacteria, other organisms that can be devastating, brucellosis. So you should pasteurize even cow's milk, not because of Toxoplasma gondii, because of other organisms. Pork is the main cause of infection in the United States. Based on the studies they have done, pork seems to be transmitting Toxoplasma gondii more than anything else, more than neighbor's cat, or more than goat's milk, and so on and so forth. Pregnant women should be careful, and you should be able to come up with a list of what pregnant women who are negative, who do not have Toxoplasma gondii. Okay, 80% of people who live in Paris have Toxoplasma gondii. Again, not all of these 80% have cat, but it seems like pork is contributing to the fact that that's what the theory is. That's what the theory is. The people, the Parisians, people in Paris. Yes, Larry.
After a woman becomes infected with T. gondii, not during pregnancy, but just later in life, is her risk for having her pregnancy affected? Does it drop down to the same level?
No.
Or is it still?
A woman can become. That's what those vet students were talking about. They can become infected now today, and they have the cold, common cold, for a week. This flu-like symptoms for a week, and then they are fine.
So
they can have as many babies as they want. Next year, 6 months down the road, anytime, have as many as baby you want, no problem. It's just during pregnancy that they become infected. Yes?
So during a pregnancy, if a woman were to get a cold, they'd be able to go to the doctor and at least identify that they possibly had it?
Yeah, I wish immunology was, yeah, you might get some IgM. Remember we talked about this a little bit. IgM appears first, and then after a few months, depends on the patient, the IgG appears. They detect the IgG, yes. If the person, and I'll show you some pictures here in a minute, but yes, it is doable. It can be done. If a woman, it's a recommendation I'll make. If a woman during pregnancy catch a cold, and you go to a doctor, the doctor laughs and say, no way. You say, well, I don't want to take any chances. You can pursue, you can convince your doctor, and then sure, they write it for you, so they can test you for that. But again, a lot of doctors, they didn't take zoology. Is that right? They didn't go to medical school outside of the United States. Mostly they went, so they say they don't know. Well, some of them know what Toxoplasma is. Maybe you should educate them. Yes?
Are the T. gondii antibodies, are they transferred to the baby through breast milk? Are they?
Well, I don't know any of study like that, but yes, I assume they do. But not, it's just during the pregnancy that can cause problems. Okay. treatment, drugs of choice, I talked about that. Do not eliminate Toxoplasma gondii. When you take these drugs, clindamycin, during pregnancy, you remember that? They will not get rid of Toxoplasma gondii. A person becomes infected with toxo, they will have it for life. I hope I'm making some sense. The person will have it for life. It's just not like you get rid of it. No. The person will, that's why they can detect half of the population have it, and we don't even know it. Okay, in Austria, what happened, once a pregnant woman was diagnosed with Toxoplasma gondii and received chemotherapy, it means clindamycin or such other drugs similar to it, chemotherapy for the disease, the transmission of the disease to the fetus was 0. Okay, they've done that study in Austria. So clindamycin, these are the drugs during pregnancy. It will stop. It will slow down. It will not stop. It will not kill Toxoplasma gondii, but it will slow it down. Okay, immunity of Toxoplasma gondii. I have a few things. Don't worry about it. This is, again, the slide is upside down, but that's okay. What happened here? This is my blood, my serum. Of course, we take my serum and put it in here, and it's all negative. And this is my advisor in Tennessee. She had a nice little daughter, very intelligent. She went to Harvard, and she got her PhD there, the daughter. And she was positive for Toxoplasma gondii. When I was talking to her, when did you become infected with Toxoplasma gondii? She said, well, when I was in the farm, she was raised in a farm, and her parents had a chicken farm. And she said, when I was going to the chicken barn and feeding birds, maybe once I became infected, cats came over and became more sporulated, or the oocyst got into the, who knows when she became infected. But she had a normal, fine baby. Okay, so we used her blood, her serum. You remember we talked about serum before. Okay, so we used her serum as a positive standard control. So this is negative control. My blood, I did not have it in Tennessee. I don't know I have it now or not. I haven't checked myself. But anyhow, this is the patient number 1. Is negative. It was an animal, but let's say human. That human is patient number 1 is negative. This patient is positive. Look at it. And here, they're similar to hers. Okay? So that patient is also positive. That patient is positive. That patient is positive. That patient is positive. The only one who is negative in this sample is that person right here. That person does not have it. You guys see what I'm saying? It's similar to the negative one. And the rest of the people, either here they have it, or here. Again, I'm not going to talk about titer and so on and so forth, but that's pretty much what this is. That was my work. Cat, something about cat you should know. Cat, when they become infected with Toxoplasma gondii, they shed the oocyst in the feces only for 21 to 30 days. After 21 to 30 days, they do not release it. So if you have a cat in the house and they have diarrhea, or they're sick, they have a lethargic a little bit, they have fever, maybe they have Toxoplasma gondii. So you can take it to a vet and they check him. I hope I'm making some sense. So the cat does not get rid of it. Cat also does not get rid of it. And what happens, they shed the oocyst in the feces only for 21, 30 days. Now there are some studies. They took some cats and they infect them with meat that has Toxoplasma gondii. Okay, you all have me now? And they shed the oocyst, they all became infected. After 21, 30 days, 2 months later, they gave them again a meat that had Toxoplasma gondii. What do you think that happened then? Yeah, most of the cat did not release the oocyst in the feces. Those that did release oocyst in the feces, they did not have diarrhea, they did not have signs and symptoms. They had normal feces, but just a few oocysts in the feces they found. Okay, so usually cats that become infected with Toxoplasma gondii, usually later on, if they eat another dose of Toxoplasma, or either by catching a bird or so on and so forth, then they do not shed the oocyst. There.
If they don't shed the oocyst, does that mean that the T. gondii didn't reproduce sexually in the gut?
Does not. It's just in the stages of bradyzoids and tachyzoids. Bradyzoid, tachyzoid in the cat. Yeah, they do not produce. They only produce that for 21 to 30 days. Right. Right. Okay, so that's another story I had to tell you about cat. Is there any other question? I think we are done. Does anybody have any question about toxoplasma? So I think with that info I gave you, you should be able to answer those questions on your discussions. If I still have not answered those questions,